Now, ITV News understands that key targets for NHS mental health care in England are to be stripped back, with no clear plan to tackle long waiting lists for help. Our Deputy Political Editor, Anushka Astana, is in Westminster for us tonight. Anushka, this is obviously happening right now. What have you been able to find out?
So on Thursday, the government is going to publish what is known as the planning guidance, which is basically a detailed instruction to NHS bosses on their priorities for this year and next. And the big focus for the NHS right now is trying to get 92% of people who are waiting for elective procedures, all physical health, seen within 18 weeks. That's to focus on that waiting list for physical health. But here's the problem. There are 1.6 million people waiting for mental health procedures, and they are not included in any of that. And I'm told from sources that the planning guidance does not have a plan for that waiting list. And there are also a worry that many smaller targets are being brushed aside in order to focus on the big one. And among those that may be threatened include the diagnosis rate for dementia, how fast people are seen if they've got an eating disorder, and also whether or not someone with severe mental illness gets a physical health check once a year, which is really important because the Royal College of Psychiatrists told us that over 3 years, 87,000 people with severe mental illness actually died of a preventable physical health disease. There are other worries beyond that. One source said to me they worry about aggressive outreach programmes not really being focused on the type of thing that might prevent when Valdo Calacane murdered 3 people in Nottingham and he had schizophrenia. So there's worries about that and big worries about funding as well. The government tell me that the ring fence for mental health spending is there and that it will increase as a share of spend in the NHS. But sources quite close to this are very, very worried that the funding might not go quite as far as that.